Up on this poster are 3 buckets. We have a distance bucket, a middle bucket, and a near bucket. The distance bucket would include things like driving, golf, tennis, outdoor activities, gardening, indoor activities like television, movies, bowling, something like that. And the middle bucket would include things like your computer, the dashboard of your car, your watch, your cell phone, your desktop work, your counter work in the kitchen, certain hobbies like quilting and woodworking and people who are artists. And then we have a near bucket, which would include reading. It would also include crocheting and needlepoint. So generally speaking, every human being is in all 3 buckets throughout their day. What kind of outdoor activities do you do, if any?
Golfing.
You're a golfer. Mm-hmm. Great. And how about middle activities? You on the computer a lot?
I am.
Okay. Any crafts or artwork that you do?
Quilting and flower arranging.
Okay. And how about reading? Do you spend a lot of time reading?
I don't spend a lot of time reading, but I do like to read.
Okay. Well, knowing that you're in all 3 buckets, my question to you is, which bucket are you in the majority of your day?
Probably the middle bucket.
The middle bucket. And what would be your number 2 choice?
Distance.
Distance. Okay. So Katie, I'm thinking of Symphony, OS, and Lifestyle OD. You agree with that one? So if you had to be wearing glasses on a part-time basis, would you want to wear them part-time for reading or part-time for driving?
Reading.
Reading? Okay. Here are your glasses back. So we're going to talk about several things. We're going to talk about cataracts first, and then we're going to talk about astigmatism. And when it comes to treatment plans, I'm going to talk about what I want you to do and why, and what the financial implication is for that. And then we're going to talk about what you can do and why, and what the financial implication is for that.
Okay.
Okay? So let's talk about the cataract. The cataract is the lens of the eye turning cloudy, and the treatment is to remove and replace. I do everything through a tiny wound of 1/8 of an inch. It's made in a way that requires no stitches. I'm the pioneer of the technique. My background's engineering, invented the technique 27 years ago. I still teach it, and I've had the pleasure of taking care of more than 70,000 patients. So I'll be the one that takes care of you.
Okay.
Now, astigmatism is the front of the eye shaped like a football. But more importantly, astigmatism causes distortion in our vision. Okay? So this is, sometimes pictures say more than words. This is what one's vision looks like with cataract and astigmatism. If I only treat the cataract and I don't treat the astigmatism, you end up here. And if I treat both, you end up here. I kind of like you here.
That's where I want to be.
Okay. Now, the worst place to put astigmatism correction is glasses. The reason why it's been done that way for decades, because that's all we had to use. But there's 3 main reasons. You ever hear the term focal point in a camera?
Yes.
Well, we have a focal point in our eye, and it sits right behind the lens. And there's a rule of optics that says the closer you bring the patient's correction to the focal point, the better the quality of vision. It does not mean 20/20, but even if it's 20/30, it's going to be a better 20/30. Well, glasses are as far away from the focal point you can be. The second reason why glasses don't work well for astigmatism has to do with alignment. Let's say this is the front of your eye, and you have glasses out here. The astigmatism has to be perfectly aligned with the front of the eye. Well, nose pieces and ear pieces make that impossible. You're always going to be at least 10 degrees off. And thirdly, when they ground astigmatism in glasses, it's primarily in the center of the lens. It's not throughout the entire width of the lens. Well, we don't look through the center of the lens and move our heads. At least I haven't met that human being yet. We move our eyes. So when you're moving your eyes behind a fixed point, you're not looking through the center. So the worst place to put astigmatism correction is glasses. The best thing to do, when I can, is to change the football to a baseball and reduce it.
Okay.
And I have the technology that works, and that's called the laser. Not only does the laser reduce astigmatism, but it does 2 other things. It makes the opening in the cataract much more precise than what a human can make by hand. And the more precise the opening, the more precisely centered the lens. Secondly, it's going to go inside the cataract and break it up ahead of time into many small pieces. So the energy to remove it is cut in half. And less energy means less trauma to the tissues and less damage to the tissues. And then the third thing that it does is it takes your football-shaped cornea and puts little incisions on the surface, changing it from a football to a baseball. So correcting the astigmatism falls under what I want you to do.
Okay.
So let's talk about the financial implication from that. The laser is not covered by insurance plans.
Okay.
Most of my colleagues around the state and around the country charge $1,500 an eye. Some charge as much as $2,000 an eye. My patients pay $975 an eye. I'm the only practice in the United States under $1,000. We purposely do that because our patients do not live in Bloomfield Hills. Okay?
Thank you.
So is that doable for you?
Yes, it is.
Okay, so that's what I want you to do. So now let's talk about what we can do.
Okay.
One of your options is the basic lens. It's called the monofocal lens. The basic lens gives you vision in one bucket and only one bucket. The advantage of the basic lens is that that's the lens recognized by insurance carriers. The disadvantage of the basic lens is you have no depth of focus. Okay?
Okay.
So I want to talk about depth of focus lenses, but before I do that, I want to just comment about a lens I don't use that much so you don't get confused when you talk to your friends and family members. The lens I don't use that much is the traditional multifocal lens. That lens I reserve primarily for people who walk in here wearing multifocal contacts and tell me that they like it. The reason is it has too many side effects, too many halos at night. And the second reason is the companies who make these lenses push the near at the expense of the quality of the distance. Okay? And I'm not sure who's going to really accept that. So the depth of focus lens is different. Excuse me, they have a distance point and a near point with everything in between, and there are two types. One type I nicknamed the lifestyle lens. And that lens has a central zone that is dedicated to distance. Now that doesn't mean 20/20. There's no lens I can put in your eye that will promise you 20/20.
Okay.
So if you want to be a personality that wants 20/20, you'll have to wear a very weak prescription to do that, okay? But it has a distance bias center, and it has fewer rings that primarily give you the middle. The gentleman who pioneered this technology for his company called it the golfer's lens. Doesn't mean you're going to lose 5 shots on your handicap, or I'd be getting that done tomorrow. But that's a little bit too narrow, so I call it the lifestyle lens. So this lens is a distance primarily and middle secondarily. The reading is limited to about 24 inches. So when I look at you and listen to you, I really think this lens is perfect for your right eye. That's your dominant eye.
Okay.
Now the other depth of focus lens is called the Symphony, with an F instead of a PH. And I don't have a picture of that up here, but you can go look it up on your computer.
Okay.
That lens is primarily a middle vision lens. It gives you reasonable distance, but it's primarily middle. And I can move that scale so to pick up a little bit of the near, give up a little bit on the distance. And I'm thinking of that lens for your left eye.
Okay.
I think you're a perfect candidate for one of each.
Okay.
And if we go in this direction, then you have to have the laser, which we've already talked about, because you cannot afford to have a lens with segments, that ring-like segments, be decentered or tilted. And you don't want to rely on a man-made opening. So I'm looking for you to have the Symphony in the left eye and the lifestyle lens in the right eye. But obviously this lens is not covered by insurance either. Most of my colleagues would charge $2,500 an eye just for the lens, not counting the laser. So that's about $4,000 an eye. My patients pay $1,350 for the Symphony and $1,250 for the lifestyle. So you're looking at $2,325 on the left eye, $2,225 on the right eye, and that would give you an extended range of vision, and you would find your vision in all 3 buckets, primarily the distance in the middle with some of the near. You might have to wear some +1 reading glasses to pick up small print up close. So how does that sound to you?
Great.
Does that interest you?
Yes.
Then let's do it.
Okay,
Questions or concerns?
no.
Okay. I look forward to taking great
Thank
care
you,
of you.
Doctor.
It's a pleasure to meet you.
You too.
So I'm going to let you finish up with Katie, and then she'll take you to the counselors, and we do the surgeries a week apart.
Okay,
So I'd like to start with the left eye first, if that's okay with you,
that's fine.
and then we'll do the right eye a week later.
Okay, doctor.
Look forward to taking good care of you. I'm happy for you.
Thank you very much.
You're welcome.